A patient that has an illness that is involving multiple organ systems really needs a direct primary care practitioner, because that practitioner is in place to take care of the overall health of the individual. He is not there to refer to a rheumatologist for a joint problem, or to refer to a gastroenterologist for a GI issue, or even to a dermatologist because there's a skin manifestation of your GI issue. The patient whose disease is multisystemic really needs a provider who has their eye on the patient as an individual and is looking at all systems at one time. That really requires a direct primary care model, because we can't have barriers to access and care. Co-pays, co-insurances, and unmet deductibles only inhibit the relationship that that patient can have with that provider, particularly when it comes to overall health and getting to the root cause of disease. What commonly happens to patients is they have a disease that is not defined by one organ system. So we have patients that happen, a common patient for me to see is somebody whose medical condition transcends one particular organ system. So if somebody has an inflammatory condition, maybe their joints are involved. We would send that to a rheumatologist. Maybe the inflammation starts in their GI tract. Well, this is an issue for a gastroenterologist. Maybe their skin has manifestations of an inflammatory condition in their GI tract that also involves their joints. This is a problem patient out there in the current system as it exists, because this crosses 3 different organ systems and you cannot coordinate 3 different medical specialists, or it's a very difficult thing to do. So with functional medicine, we are not looking at the person as an individual organ. We're looking at them as a whole, and we understand that one condition is going to impact multiple organ systems. So we are not stuck dealing in one area. We only do GI. We only do rheumatology. These patients, and I see them every day, it tends to happen that the rheumatologist may follow them for the joint pain, but the origin of the disease is in their GI tract. So there is never really any true understanding of the problem and never addressing the root cause of the disease. And this is just a function of the way our system is made. In functional medicine, we want to go back and address that root cause so that we don't have issues and manifestations of that disease in multiple organ systems. And if we can reverse that singular issue, then we don't need a rheumatologist, we don't need a gastroenterologist, and we don't need a dermatologist, because we figured out what the problem was and we addressed it right where it started.